After years of discussion and debate, the Affordable Care Act, also known as Obamacare, is finally a reality. If you're like most people, you probably have questions on what this means for you and your insurance coverage moving forward. Fear not. Over the next several minutes, we'll take a quick look at what's changing, the options available to you, and what may work best for different people in different situations. To begin, let's define the new government marketplace and government subsidies. The government marketplace is a collection of insurance plans offered by private insurers. You can use the marketplace or go direct through insurance carriers to shop for insurance if you don't already have coverage, or if you do but want to look at other options. A subsidy is a maximum premium you would pay based on a percentage of your income as it relates to the poverty level. We'll be taking a closer look at subsidies and how to qualify in a little bit, but next we'd like to focus on two categories of people: those with access to an employer health care plan and those without access to an employer health care plan. Which of these you fall under makes a big difference, so we're going to take a look at each one separately, starting with those who currently have access. If you're currently eligible for an employer's insurance plan, your first step is to determine if that plan is considered affordable under the new law. For a plan to be defined as affordable, your annual contributions to a single coverage plan cannot exceed 9.5% of your gross income. Basically, this means all the money you contribute to your plan throughout the year needs to total less than 9.5% of your annual gross income in order for your plan for single coverage to be considered affordable. Keep in mind, this affordability test is only applicable to the cost of single coverage and not family. This means no matter how expensive your family coverage may be, it will not be considered unaffordable as long as the single coverage option in your plan falls under 9.5% of your gross income. So let's say you've done the math and your plan is defined as affordable. This means you would not be eligible for any subsidy if you were to opt out of your current plan in favor of a plan from the new government marketplace or direct through an insurer. On the flip side, let's say you've totaled up all your contributions and discovered your plan is defined as unaffordable. In order to qualify for a subsidy, you would also need a total household income of no more than 400% of the poverty level for a family of your size. As an example, in order to qualify for the minimum subsidy that would cap your premium costs for your family at 9.5% of your total income, an individual would need to make less than $45,960 and a family of four less than $94,200. If you think you may qualify for a subsidy or would like more information on available plans, visit www.jmwsons.com and click on Individual Health Quotes. In most cases, it is advisable for those who currently have access to an employer health care plan to stick with it if possible, as the out-of-pocket expenses of switching to a marketplace plan are often higher. Now let's take a few minutes to discuss what all this means for non-eligible employees. If you are not currently eligible to partake in your employer's healthcare plan, you now have the ability to secure coverage for both you and your family through the new government marketplace or individual insurers. As we covered earlier, the marketplace is a collection of insurance plans offered by private insurers. If you are not already eligible for coverage for an employer, the marketplace represents options and coverage previously unavailable to you. You may also be eligible for a government subsidy. As we said earlier, a subsidy is calculated as a maximum premium you pay based on percentage of income as it relates to the poverty level. This means if you meet the required income levels for a family of your size, a subsidy would be paid directly to the insurer to lower the cost of your premium. If you qualify and how much of a subsidy you would receive is based on your household income. Just as we saw before, in order to qualify for the minimum subsidy that would cap your premium costs at 9.5% of your total income, an individual would need to make less than $45,960 and a family of four less than $94,200. Also keep in mind that if you were at or below 138% of the poverty level, you would not be eligible for a subsidy, but instead for Medicaid. To see marketplace and individual offerings, and to see if you qualify for a subsidy, visit www.jmwsons.com and click on Individual Health Quotes. This link will provide you with more information on the coverage and options available to you and let you begin the process. You also have the option to not select any insurance at all. If you do, you will still have the ability to gain coverage at a later open enrollment date, but you will be assessed a fine of $95 a year or 1% of your total household income, whichever is greater. This penalty is scheduled to increase, and also keep in mind that open enrollment only takes place once per year. So to summarize, you either have access or do not have access to an employer's healthcare plan. If you have access, it may be advisable to stay with your current plan in order to enjoy the lowest out-of-pocket expenses. If you do not have access, you can now use the government marketplace or individual insurers to shop for insurance plans and see if you qualify for a tax subsidy. Either way, we can help you navigate your options to ensure you and your family have the coverage they need. For more information, and to shop or buy, visit www.jmwsons.com.